It's extremely important, and in my mind, it's particularly as it relates to the whole response to HIV globally and in this region. So from the very beginning, the HIV response was grounded in community response, and that's for historical reasons in the US and in the West, but in other places as well. And because of that, fortuitous, if you will, beginning, we have a response that's grounded in human rights-based approaches, human rights principles, and ensuring that we're addressing issues of stigma and discrimination. Within HIV, certain folks are more at risk than others, and we call those in the UN system key affected populations. And among the key affected populations are gay men, other men who have sex with men, injecting drug users, sex workers, and transgender people. And of all of those groups that we've been working with over the years, it's probably transgendered people that have gotten the least amount of attention around the world and including in our region. And our hope, my hope, is that our engagement in the partnership with transgender people themselves and transgender organizations, along with other partners, will help us begin to address that gap in the response. The challenges very often are societal, cultural, sometimes tinged with issues of religion. And at the end of the day, they're very much tied to something I mentioned before, and that's stigma that can lead to discrimination. So if transgender people don't feel that they have the opportunity to be who they are, express who they are, live their lives as who they are, and be a part of the community and community decision making, and they're not being able to do those things because of who they are, then that's a huge detriment for the community itself and certainly for the HIV response. And so my hope is that we're able to overcome those challenges, and it's going to be through partnership.
Thanks.
You can ask somebody what the priorities are for this sort of challenge, that is the HIV response or the human rights response, and everybody's going to have a different answer. There are lots of priorities. So I'll speak to ones that I think should be high up on the list, and there are three: legislation, law enforcement, and human rights frameworks. And relative to legislation, it's very simple. We, as countries, as member states of the UN, we need to design laws that work for transgender people. For law enforcement, we, that is community-based groups, the UN system, other partners, we need to advocate for, with law enforcement agencies to ensure that they are protecting transgender people, and particularly protecting transgender people from violence, including and especially sexual violence. In terms of human rights frameworks, we need to figure out a way to ensure that we're all using conventions, treaties, declarations, court case decisions to protect the human rights of transgender men and transgender women across Asia and throughout the Pacific. My hopes can be summed up as partnership. I think that this, a lot of what's happened already in terms of human rights, health, and transgender people has come from the communities themselves in individual countries, individual communities. And this is one step in the process, but a very important step, and that is where the UN is taking ownership for and taking responsibility with communities themselves to address these critical issues. And so my hope is that this discussion over the next couple of days, the process that we're talking about, takes us to a place where we have much stronger partnerships, the UN system, governments, the member states of the UN, and civil society, and particularly including transgender civil society organizations that speak for transgender people and their experience. So my hope is that that partnership will lead us to a place where we're actually having a better impact on the HIV epidemic in this region. To follow on from Steve Krause from UNAIDS' comments about feeling lucky to be in the system at this point, I would just say that it is actually a very important place that we're at in this region and globally in terms of the response, the organized response to transphobia, to human rights and human rights violations of transgender people, and to improved responses for HIV that have to be grounded in addressing stigma and overcoming discrimination. And so my boss, starting with Helen Clark, the head of UNDP, and the folks above her, and certainly folks all the way down, are quite committed to this. And it's a part of the discussion we're having on an ongoing basis in our discussions within UNDP relative to our democratic governance work and not just our HIV and health work. It's really about the nexus between those two things for us. And it's a real initiative that's happening now within the organization, and I'm looking forward to seeing where it goes.